Misconceptions about the Washington Health Trust and Universal Healthcare, brought to you by Whole Washington for Universal Healthcare in Washington State. First, there was a great article in The Stranger that created a lot of the comments that we're going to use today. It was called "We Could Have Had Universal Healthcare" by Tobias Coughlin-Bogue. The comments on this article and the corresponding Reddit thread were mostly positive, but let's look at the negative ones and address some of the misconceptions about the Washington Health Trust and Universal Healthcare that came up in those comments. So if everybody loves universal healthcare and all the politicians involved say they do, why didn't it get a hearing? Well, let's look at that. The Washington Health Trust did not get a hearing because the chairs did not bring it forward. It's as simple as that. Everybody loves universal healthcare in the abstract, and they hate it when you get specific about how to implement it. This article just sort of glosses over the fact that the plan to pay for it is an income tax. The plan isn't an income tax, and most of the funding comes from employers. For a percentage of employee wages, it's essentially a payroll tax. There is a capital gains tax, but it doesn't kick in until more than $200,000 a year and excludes a lot of the most common capital gains. And employers are already paying their share of the health premiums, so the cost should actually be very similar for most employers. I don't want universal healthcare. Why? I grew up with it. It was a nightmare of shortages, wait lists, and mediocre care. I get much better healthcare in the United States. Most people don't get better healthcare here in the United States. As you can see, the United States underperforms in lifespan and also in the health expenditure per capita. So we spend way more and people live less long. As far as wait times go, the United States is actually quite bad in terms of the wait time for primary physicians or general practitioners. For the wait time for elective surgery, we're quite good. We're among the best countries, including other countries with universal healthcare, by the way, like Italy and Germany. And you can see the real issue is the number of doctors. A lot of these countries have more doctors than the United States has. And a lot of people use Canada as the counterexample, but Canada has very few doctors. We already have more doctors here in the United States, so we will not see the wait times that Canada sees. Now let's move on to the next comment. It gets a little out of the weeds. We're going to focus on a couple sections. While universal healthcare may be better in aggregate, the other issue you're going to have is you're going to ask all those people who have great healthcare right now via their employers, like people at Microsoft, to reduce the standard of care they are receiving today while paying more for it, so that those at the lower end of the spectrum will have enhanced coverage. That's not fully correct. The Washington Health Trust will provide significantly better coverage than most private health plans. If it does not, employers like Microsoft could still provide a private option to their employees. And this is really important because it satisfies ERISA, which is a really important health statute that we need to meet. The author does bring up that there will be a huge increase in demand for healthcare initially, and this is true. We're going to need more healthcare professionals in Washington to keep our wait times at a reasonable level. The next part of the comment is, I understand in the long run, it may reduce the overall costs of care by preventing issues early, but the fact remains that in the first decade or so, the cost of establishing universal healthcare will be enormous. This actually isn't true either. The Washington Healthcare Authority found that universal healthcare would actually save money in its implementation year, and then would save even more money, about 7% of current healthcare spending in the state annually when it's fully implemented. Another analysis by Dr. Gerald Friedman estimated even higher savings, and this means the Washington Health Trust would be cheaper, better, and cover more people. Next comment, switch it over to Reddit. People hate the funding mechanism the bill used for universal healthcare. It'd be great to have our state come up with an actual solution. Our funding has changed over time thanks to the feedback we received, and many people have an outdated perspectives. I recommend checking wholewashington.org and looking for the newest funding there, but as of March 2025, most of our funding comes from employers and sole proprietors, and a small portion comes from investors, but it doesn't kick in until past $200,000. We can't stomach the income tax that would go along with it, nor could we afford to lose large business if we tried to reclaim the tax from them instead. Let's talk about that. First, the average private sector healthcare benefit as a percentage of employee salary is actually 7.6%. Under the Washington Health Trust, this would cost those same larger companies in the private sector 8.5% of employee salary, with the employees covering 2%. Those are pretty similar numbers. This will remove healthcare as something businesses have to worry about. This will make it easier for entrepreneurs to start a new business by not having to worry about healthcare. And this will allow small businesses to afford coverage for their workforce. Everyone wants free healthcare, but nobody's willing to pay for it. Would you be willing to pay 30 to 40% of your income, as they do in many places in Europe or Australia? First, we already pay a tax for healthcare. It's called medical premiums. It's just a tax to a private company. And you can see that if you look at the public and private spending for healthcare, The United States vastly outpaces every other country in terms of our private spending, and that's a tax. It's just not a tax you pay to the government. Next comment. Not everybody wants this. Private is better for people who secure a job with good health benefits. I'll vote for it if I could opt out of the tax, because I don't need the benefit. And undoubtedly, the tax will double over the next 5 years because our state cannot budget properly. First of all, the benefits under the Washington Health Trust are really good. Also, its funding vehicle will be separated from other state resources like the general fund, and the board will be a majority citizen-led. A lot of healthcare professionals and people from different groups in Washington. It'll provide comprehensive coverage, including medical, dental, vision, hearing, mental health, and reproductive care. There will be no deductibles, no copays, no networks, no denials, no bills, zero out-of-pocket spending. This is very good coverage. Want to help universal healthcare succeed in Washington? Pledge to sign our initiative. Sign up to volunteer. Donate to our cause. Print our literature and put it up where people can see it. Possibly attend something on our calendar, like an orientation, to learn more about the organization. And I hope to see you in future videos.